Welcome back to the exam room. Today we're speaking with Dr. Satya Sarma about the real world work of transforming healthcare delivery. And as organizations continue navigating value-based care, Dr. Sarma offers a unique perspective shaped by leadership roles across public health, Medicaid, and payer systems. Let's turn now to some key takeaways for leadership. If leaders take nothing else from this conversation, what would you hope that they would focus on?
That's a great question. I really want to speak from the perspective of a clinician. I think we're at a time when these different forces in the payer world and the way we pay has really put clinicians in a position of stress. I mean, we all talk about, we know about it, right? Like we talk about burnout and disillusionment, and sometimes even, we see, I even hear providers talking about alternate careers because the reality is they have their student loans to pay at the same time that the reason they went into the profession isn't being fulfilled because of the way the business side is set up. If I were to ask leaders to do one thing, it is really to come to the table with a mindset and intention to support their clinicians. That's what I would say. I think is really important. And understanding that there's so much that they're juggling. There are so many pressures they have in terms of, as leaders, in terms of making a practice sustainable. But I think that it's really, really important to come with a sort of a prioritization of supporting their clinicians, because at the end of the day, most clinics are aiming to serve their communities. And in healthcare, that comes down to their clinicians. And I'll take it in a broad swathe, right? Like I don't mean just their doctors, their nurse practitioners. I mean their nurses, I mean their MAs, I mean their community health workers. I mean the entire staff that interacts with the patient and helps them move their healthcare goals forward.
We've had this similar conversation on the podcast before about getting the buy-in of, the frontline workers. I mean, sometimes leadership, they are clinicians that have kind of moved up into that role, but sometimes they're not, right? Realistically. So as a leader, I might be making a decision that looking from this aerial view that I seem to think that it makes sense. But if I'm not collaborating with those people that are actually executing it, I mean, it's just good business sense, I think, to talk to those people and to get their perspective and to get them on board. Nobody likes, well, you're going to do this and you're going to do it because I said so. Some people might respond okay to that, but most people don't. They want to be heard because it might impact their patient in a way that doesn't make them feel good, or now they have to give their patient some bad news because of this decision that was made from the tippy top. So I really like that aspect of focusing on the clinicians as the priority.
I know that not everyone agrees with me or will agree with me, but I really want to see healthcare back in the hands of clinicians. As I've been in my different roles, one of the things I've often done is encouraged medical students or residents to look at, for instance, the work I do as a payer. And the reason is because even when I was in practice, so I was explaining, right, like decisions about what happens to patients are made by policymakers or payers or, forces outside the clinician's control. And while, we think of clinicians as belonging in the exam room, pun intended. The thing is, I really think we need that perspective at those decision tables, right? Clinicians come in with this mission and this responsibility to society. Most of us have some sort of oath we take. And it's not an oath of allegiance to business success. It's an oath of allegiance to society, to patients whom we're going to impact. I think it's really important for leaders to involve clinicians in decision making wherever possible. I would personally like to see a table for healthcare led by clinicians, or at least people who are prioritizing the clinical mindset, because that oath binds on them even when policies are being made, right?
Yes.
And so I think it's really, really important to, as much as possible, try to give the reins to your clinicians wherever you can. They're not going to be able to do everything. You've got, they might not have the business skills that are needed for certain things, but from a standpoint of how the healthcare world is set up, they should play a really key role. And I would like to see them actually take the reins on certainly the decisions that impact patient care.
I think the more perspectives that we can get, the better too. Even when I was running my search tech program, our accrediting body required that we had a program advisory committee, and that was made up of search techs that were in the field, surgeons, faculty, students, leadership that would be hiring, the grads when they came out, the patient perspective. Right. So there was somebody that represented the patient that sat on my board, and we would talk about the program, everything soup to nuts, that went on during the year, what our grad rates were, our placement rates, our certification rates, all of those things. And this is what we're doing. And what do you guys think? Let's get everybody's view so that, I think the more perspectives we have at the table, and we would be remiss if we didn't bring the perspective of our clinicians to the table when decisions are needing to be made.
Yeah, I love that. And you're right. Giving patients a voice in healthcare is also important.
Yeah, very important. One last question that I have for you regarding like practical steps or health centers can take immediately. You mentioned identifying high-risk patients, stratifying their patients, if you will. Are there any other steps that you would suggest that are very practical that they could implement right away?
You need some data to be able to do this, but I would say the starting point can be, in addition to identifying those high-risk patients and engaging them, would be focusing on the transitions of care and your high utilizers. So what that involves is making sure you have good data sources and data analysis, but also that you have that team approach, that you have people who not only have clinical skills, but understand how to assess and address social needs, that you have some resource that can address behavioral needs. I would say it's really important to start, the key thing is to start somewhere. You're not going to have it. Yes. We can all wait for, like, everybody is running on not enough resources, not enough staff. That's just a reality of what has happened in our system. The important thing is to take some step that you can take today, then keep working on what resources you do need. But there's got to be one thing you could do, right? That's the way to approach it. And then you get that down and you have a process or a system for the next thing and the next thing and the next thing. So continuous quality improvement, right? As that mindset is really key.
It makes me think of something that I've heard a lot of different people say since I started working with VB Care. If you've seen one health center, you've seen one health center. So what we say here might be good, like for you and your practice might not be the best for somebody else, but figure out what that is. Like, do what you have to do to figure out what that good first step is and take the step. Because every small step leads to big accomplishments. It's a series of, it's the Kaizen method, right? Of a bunch of little steps leading up to big results.
Yeah, you hit the nail on the head.
I think this conversation has been incredibly insightful, and I'm so grateful for being able to have this time with you. And for our listeners out there, if you enjoyed the episode, share and subscribe. And we'll see you next time on The Exam Room.
Over the past 3 episodes, we've explored the evolution of value-based care through the insights and experiences of Dr. Satya Sarma. We began by examining what value-based care truly means, focusing on better outcomes, stronger patient relationships, and a healthcare system designed around the needs of the people it serves. From there, we moved into the practical realities of implementation, discussing how organizations can identify high-risk patients, improve care transitions, strengthen patient engagement, and build systems that proactively support better health outcomes. Finally, we explored the leadership principles that make lasting transformation possible, including supporting clinicians, involving frontline teams in decision-making, and fostering a culture of continuous improvement. Throughout this series, one message has remained constant. Meaningful healthcare transformation happens when patients remain at the center, clinicians are empowered to lead, and organizations commit to delivering the right care at the right time for the right reasons. A special thank you to Dr. Satya Sarma for sharing her expertise and perspective. And thank you for joining us for this 3-part series on value-based care, healthcare leadership, and the future of patient-centered care. Until next time, this has been The Exam Room.